Okay. So I'm Sunita Patel. I'm a physiotherapist. I passed out in 2006 from MD University, Haryana, Rohtak. After that, in 2015, I started pelvic floor, and I found that this topic is something which is missing in our curriculum. And it's been like 2026. It's been like 11 years now. I'm into this field. And when I'm talking about, whenever I'm experiencing pelvic floor, whenever patients are coming, I always feel that this part is something which should be a part of curriculum, and every physio should have some understanding, even basic understanding about pelvic floor. You might have heard about so many pelvic floor workshops, educations going on around you across the world. Sometimes they are expensive, sometimes they are out of your time. You can't manage going to them. And so I think, but I believe that this kind of sessions can help you a little bit whenever you are going to see your patients next time. Because now try to understand a female body or a male body when you are saying core. So core is not only abdomen. Core is everything. So core is like, the whole body is working on a pressure system. Every second we are having this inhale, exhale, the breath work is always going on throughout 24 hours. So this work, the breathing is going to create lot of pressure here to there into the body. So the moment we are inhaling the air, so try to right now do the inhale with me and feel how your body is working with this pressure system. So the moment you are inhaling the air, inhale it with me. You will feel that air is going in your chest, and your chest cavity is working. Your thoracic cavity is moving anteriorly, like piston, anteriorly, posteriorly, laterally, everywhere you can feel the air. So please feel the air with me in your chest cavity. Take a deep inhale through your nose. Can you feel this expansion in your chest? Okay, now you can feel there's an abdomen, and that is the abdominal diaphragm is present, and that is also going downward. So feel the abdominal diaphragm movement when you are inhaling, down and up. Okay, so feel your chest, feel your abdominal diaphragm. Now, same way, again take an inhale and feel this air in your abdominal cavity, and feel this air into abdomen anteriorly, posteriorly, and laterally, everywhere. Please feel the pressure. You can feel the pressure in thoracic cavity, abdominal diaphragm, and your abdomen. Now, same way, again do the same exercise. Inhale and feel this air in your pelvic cavity. You can touch your ASIS or your ilium and then inhale. Can you feel this pressure in your pelvic cavity? Now, if you are somewhere at your home and you can touch your areas, private areas, you put your hand below in your, around your pubic symphysis, if you can touch. Put your hand around pubic symphysis and again inhale. Can you feel that is also working? Expanding out and in? It is. So it means the whole body, if you touch at the back, if you touch on the side, if you touch abdomen, if you touch chest, everywhere, you can see this breath work is creating a pressure system. And this system is the centrally, when we are talking about, is the core. That core means the central part. Into the central part, anteriorly we are having abdominal muscles, posteriorly we are having all this spine, side we are having obliques, on the top, we are having abdominal diaphragm. What is there on the down? Another muscle, pelvic floor. So now, every breath you are taking in, your, all the system is going for descending. Everything is going down. Whenever you are taking exhale, all the system is going up. The abdominal diaphragm and the pelvic diaphragm are like this. They will go down when you will inhale. They will go up when you will exhale. So please, this is the first system we should always keep in our mind, that pressure system and correlation between abdominal diaphragm with the pelvic diaphragm. Okay, so they are also always going to do the same work. Exhale, up, inhale, down, exhale, up, inhale, down. So now this breath correlation, the correlation is very important to whenever you are dealing your patients. It can be the back issues, it can be the thoracic cases, the respiratory issues, it can be abdominal weakness, and it can be even your pelvic floor. Now, let me give you more understanding. You are clear about your abdominal muscles, that you have certain muscles there. Post also, back muscles are also there, lateral muscles there, thoracic muscles there. Every muscle was the part of our curriculum, but pelvic floor was not a part of curriculum. And the reason behind that this muscle is somewhere in like kind of sensitive area. So, and these muscles are inside the body, and when we have to understand the muscle, we have to talk about the private area of a female. So this is very important. So that's why I don't know why that seniors has not taken that step, giving this education to the people. But I think this is a high time, because every other person, they are suffering from pelvic floor issues. You will understand after understanding the pelvic floor muscle. So now let me start giving you a little bit of understanding of the pelvic floor. So see, what is this? This is the pelvic bone. This is our pelvic bone, ilium, pubic symphysis anteriorly, sacrum. And you can see that these two pubic bone are joined here with the pubic symphysis. And then posteriorly, we are having this two SI joint. And you can say that when angle is being created here, and you are aware about this angle, pubic arch angle. They are calling it as a pubic arch angle. So this is the pelvic cavity, pelvic bone. And when this pelvic bone is here, so which organs are present into the pelvic bone? So there are different organ, different people. Like if it is a female, there will be uterus present. If it is a male, there will be uterus will not present. So in a male and female body, there will be different organs will be present. Now, those organs are pelvic organs. So assume that these are the organ in a female body. So first organ is this bladder. Everyone is having male and female. We are having bladder. The difference between female and male bladder is like male bladder has a prostate here, but this is a female bladder. So the bladder is same in a female body, little bit size difference according to the surface areas. So you can say that just behind your pubic symphysis, one organ is present, and we are calling it, this organ is, role of this organ is collecting the urine from ureters from the kidneys, through the ureters from the kidneys. It will keep collecting it, and it is placed just behind your pubic symphysis. The moment you are saying that, you might see some of you touch your pubic symphysis and just above than that, try to press posteriorly. If you touch pubic symphysis and press like this, lower abdomen, you might feel urinal sensation right now. Can you please press it and feel it? The moment you will press it and you are feeling, yeah, there's something bladder. So this is a urinal sensation. You can touch suprapubically. So that means that this organ is situated into the pelvic cavity when the organ is empty. The moment you will pass your urine, organ will be empty. So this will go, it will stay inside the pelvic cavity. The moment the feeling will start, so this is going to expand upward and it will come into abdominal cavity as well. So this is a highly kind of a mobile animal, which is a mobile organ, which is present here into the pelvic cavity. Okay, first organ. Same thing is happening into male and female. This organ is having one canal. The canal is the urethra. So this is a urethral canal of a female body, which is kind of a size of a small finger. So this urethra is, if it is staying here, so you can say that this urethral opening is somewhere outside here. So this, through that we are passing the urine, and this opening is present in a female vestibule. So female has a vestibule externally like this. If you'll see the female body and it will open up, so this is the female vestibule, and into this vestibule up here is the opening of urethra. So this is urethral canal. Outside this is open, and this internal opening of the urethra is attached with the bladder. And bladder is the first organ which is present anteriorly into the pelvic cavity and into the system, and it is doing all this urination. So urine will come, it will hold the urine, and it will keep filling the urine. And after that, when the urge will be there, when this whole urine will be filled up, it can't expand more than that. Then the urge will be created by the brain, and it will relax this whole sphincters. Urethra will be relaxed, and urine will come out, and we can pass urine. So this is a passage through what the urine is coming out. Same way, you can say that this passage is again something is there onto the passage which is creating kind of doors around the urethra. Urethra is like we don't want that it can open up anytime and we can urinate anywhere. So like animals, like you can understand the cow, when the cow is walking, she's urinating. So we have two type of sphincters there. One is the internal sphincter. That internal sphincter means the organ itself is working as an internal sphincter. Brain will send a signal to the urethra to relax. Urethra will relax and urine will start flowing out. But that is common in other organs because internal and external, both sphincter will open up. Internal sphincter is made up with the smooth muscle organ, and external sphincter is made up with skeletal muscle, which is the our muscles we are saying, like what we are working. So these muscles are pelvic floor muscles, which is present down here. So these are the muscles, and you can say the muscle is kind of quite the whole base of this um, pelvic cavity, the whole floor of the pelvic cavity is somewhere covered by these muscles. And if these muscles are not there, you can understand the organs can't stay, they will fall down. Okay, and we have to all the time stay against the gravity also. We have this is our functional activities, during our functional activities. So these muscles, which is present here at the door, at the foundation, we are calling them at the floor, we are calling them pelvic floor muscles, and they are skeletal muscles like other muscles of the human body. So these muscles are going to work as depending upon the number of fibers they are having. 70% of muscles of these muscles, 70% of the fiber are made up with slow twitch muscle fibers, and 30% are made up with fast twitch muscle fiber. So the whole 100% is some muscles will work for a sudden activities, like whenever we are sneezing, coughing, sudden action. So whenever the sudden action will be the requirement of the body, those fibers is going to create a contractions. So fast twitch muscle fibers are going to work, like sexual activities, orgasmic reflexes. Like you can say that suddenly you have to squeeze, like whenever you're jumping, lifting, sneezing. So these muscles are going to work reflexively. So this is a fast twitch muscle contractions. 30% of fibers are there. Same way, the slow twitch muscle fibers means throughout the day, sustained endurance. We don't want the muscle should go downward and saggy because you can understand the gravity. So gravity can always keep pulling the muscles downward. So muscle should have that kind of fibers should have that kind of fibers which can work against the gravity and which can create a sustained pressure there, and the endurance can be controlled. So the support, upward support. So this is very, very important. So this how the muscle is, the whole pelvic floor muscle is having 70% of slow twitch muscle fiber and 30% of fast twitch muscle fiber for doing their functional activities depending upon whatever is the requirement. So now let's understand, like you can say that this urethra, so the urethra has to pass through this floor. So this is the floor, and if I'm putting this organ here, so this is the deeper muscles of the pelvic floor, and you can see that this organ is resting onto the muscles. So deeper layer is the layer is working. You can assume it the floor where you are sitting right now. So the floor is the deeper layer of the pelvic floor, and where your legs are, you can touch the legs. So on the floor, the organs are sitting. So this internal muscles, this floor is the levator ani muscle. You might have heard about deeper layer. So deeper layer is a very important muscle which can come direct connection with the organs. So it means the name itself is saying levator. It means you elevate. So organs has to be supported and elevated upwards. So we don't want organs to sag down and fall down. If this muscle will get weak, organs will start falling down, and this is what we are calling as a prolapse. Okay, so this muscle is very important, deeper muscles, pelvic floor. Same way, it is not only that the support system, even this canal is passing through that floor. So let me show you my PPT, and it is going to give you a little bit of more clarity as a beginner. So, oh, sorry. Can you see the slide? So this is a pelvic whole bone, and into this bone we have kind of the female body and male body bone is different. You can take a screenshot of this slide and read it. And these are the ligaments which is holding this bone in the right position. Actually, we don't want anterior tilting, posterior tilting, lateral tilting. So we have ligaments which is holding that in the right position. Same way, this whole pelvic cavity is having 3 organs in a female body and 2 organs in a male body. So just behind the pubic symphysis, what we are saying is bladder is present, and after that urethra is the canal. And you can see the difference between male and female. This is a male bladder, which is a little bit bigger into size, and male bladder, and after that we have urethra. Urethra of a male is quite long, 17 to 18 inches long, as compared to female bladder. Now you can say that this bladder is straight. This urethra is straight. Female urethra is completely straight, but male urethra is angulated and round, and it is crossing through 3 different structures. As soon as it starts from the bladder, it goes and passes through the prostate. After that, which is a sexual and reproductive organ of a male. After that, it is passing through the pelvic floor muscles, and then it is passing through the penile structure. So 3 different passages it has to cross. 3 different structure it has to cross: prostate, pelvic floor, and the penis. But female body, this organ, urethra, is only crossing straight the pelvic floor. So nothing else is surrounding that urethra. It is only the pelvic floor. So one door is there, and that door is made up with the skeletal muscles, and these muscles are going to create a closing and opening whenever is required as per the body. So whenever we want to, throughout the day, this muscle should have a tone, means closing around the urethra. Urine will not come out. Urethra will be closed and compressed. And we can always sustain and maintain that filling phase of the urine. And whenever the brain will send a signal to the body that there is the bladder is full, then only the urethra internal sphincter will relax. And after that, we will stand up, we'll get up, we'll go to the go to the urinal, we'll sit down, and then the external sphincters, which is trained, will relax. Means pelvic floor will relax. They will go out from the urethra, and we can urinate. So they are helping. Our pelvic floor muscles are helping us in maintaining the continence for some time and helping us to urinate during the urination. So you can understand, if these muscles are tight around the urethra, so male or female, they both can have difficulty in passing the urine. So it can be voiding dysfunction. Patient might not be able to pass urine completely. So if the urine might be, the muscles are tight. If the muscles are tight, door will not open completely. So you can't empty the bladder. So that can be the issue of the bladder health. And the other way, you can say that if these muscles are loose, so the moment the bladder will get filled up, and any stressful activities, like any thing we are doing, like which is increasing the intra-abdominal pressure, that pressure can compress the bladder, and bladder can compress that urine downward, and urethra can relax, and automatically, if the muscles are not strong enough to hold across, so you can understand the urine drop can come outside. So whenever you can understand, muscles are not strong enough to create a compression, strength, hold. Strength is not there. Activation is not there. So you can understand they are not active muscles. So in this case, urine leakage will be kind of symptoms. Patient might feel it. So urine leakage is there. So why the leakage is there? Why we are not able to control it? Because the door is not strong. It means muscles are weak. So whenever muscles will be weak, that leakage can happen. And whenever muscles are tight, you can't pass urine, or you can't completely pass urine. Okay, so voiding dysfunction can happen. So this way, these muscles are directly related to the bladder health. So this is telling us that we should start working with urologists, because but in the society, whenever someone is having an issue with the urination, so the one expert word is coming in their mind is urologist. So they might go to urologist, and urologist will try to find, they will, by taking the history, they will find out that patient is suffering from voiding dysfunction, and one reason out of that can be tight pelvic floor. So you, as a physio, if you are attached with the urologist, so you can treat their patient by relaxing those muscles. The way you can relax trapezius, the same way we can relax the pelvic floor muscle also. Same way, if the patient is suffering from stress incontinence, urge incontinence, so we can help strengthening those muscles, and you can increase the strength by giving exercises. So we should definitely start expanding our practice and start talking to urologists and start joining our hands with the urologist, that we can help the patients if they are having issues related to the pelvic floor. Muscle is tight, we can relax it, and muscle is weak, we can activate it and strengthen it. So this is the urology and that bladder health, where our role can be huge. Believe me, 40% female and even male also, after a certain age, they suffer with bladder health issues, and where the pelvic floor is one kind of culprit, when it can be over tight or it can be over weak. After this organ, which is anteriorly, behind we have another organ in a female body, and that organ is uterus. Every month we are having this monthly cycle going on, and uterus is attached with the vagina, and through the vagina the urine, this periods are coming outside. So you can also understand, vagina is again made, it's a smooth organ. Again, it is the middle part, middle organ into that pelvic cavity. So this is a centrally situated organ. Now, this organ, vagina, downward, 25% of down part of the vagina is crossing through the pelvic floor. If the muscles around this vagina, if they are tight, so you can understand, if the door is tight, so blood is liquid, so blood can come outside. But if you want to insert something inside, like for example, we want to insert tampon, menstrual cup, gynecological examination, finger insertion, or sexual activity, sexual intercourse, so if these muscles are tight, female will not tolerate that penetrations. So muscles can be tight, which can give difficulty into perineal touch, or into dilation, or into penetration, or even after the penetration, there can be pain during sexual activities. The muscles from superficial to deeper, all the muscles can show you different things. So the muscles are tight, so they can give difficulty into penetration, or sometimes there will be no penetration at all. So these conditions are related to the sexual health or related to the reproductive health of a female. So you can understand, if these females, these muscles are completely tight, so what will happen? You can't penetrate. It means all this internal going on, or the touch, might be gynecological examination, or even intercourse, can be very difficult or might be very painful. So because muscles are tight, and these conditions, if you have a pain on the external touch, you can't even go inside, so we term it as a vaginismus, vaginal muscle spasm. So around the vagina there are three layers of the pelvic floor: outer, superficial, middle, and then inner, deep. So superficial, middle, and deep, whatever layer around the vagina is tight, so we are calling it as a vaginismus, vaginal muscle spasm. So in that case, females can't tolerate penetration at all. They will have severe pain, and they can lead to avoidance of the touch. And you can say, if she is a female who is married and she's planning for a baby, after that, after marriage also, whenever intercourse will be there, she can't go for intercourse, might be. According to the new studies, one studies just happened into Kerala 2024, there are approximately 17 to 36 percent of female, they are suffering from vaginismus. So it can be outer muscles tight, middle muscle tight, or inner muscle tight, all the pelvic floor. So vaginismus is affecting a lot of people into the community. So muscles are tight, so we can help our female to relax those muscles externally around the opening and even deeper by our therapies. So this is a very important role of us in vaginismus. Sometimes female don't have completely tight muscles. The opening can be there. You can insert your finger inside, but after insertion, only deeper muscles are tight. Deeper layer, levator ani is tight. Obturator muscles are tight. All the muscles which is attached with the internal structures, they are tight. So that female can have a pain after penetration or pain after having sexual activity. Any female which is not feeling pain during the sexual activity or during the penetration, she might have pain afterwards, even during that, not during the penetration, but during the activities, sexual activities. She's having pain, or after finishing the sexual activity, she's having pain. So, this term we are calling it as a dyspareunia. 40% of female in the world, even in India, they have painful sexual activities. So now women are living with it and they are thinking that sexual pain is somewhere normal. But no, this pain can be related to the tight pelvic floor. So we can help our female when they have a vaginismus and whenever they are having dyspareunia by relaxing those muscles. And we can even if the sex will be comfortable, if the penetration will be comfortable, you can understand the ejaculation of the sperm inside the vagina can be also good. So after ejaculation, she can get pregnant. So whenever you can't enter, the penis can't go inside, ejaculation can't happen. Ejaculation can't happen, she can't get fertile. So it can affect a female fertility also. So you guys can indirectly help achieving a female fertility. And the second is orgasmic effect is something which is related to the sexual health. If she will have tight pelvic floor and she will feel pain, so she can never feel pleasure and she can't ever have orgasm. So orgasmic dysfunction might be she suffer from. So you definitely play a big role with the female reproductive system by relaxing those muscles. You can help her in sexual functioning, good sex, pain-free sex, and even making her fertile by relaxing those muscles which is tight around that area if they are tight. The other side of these muscles can be if these muscles are relaxed, over relaxed, they don't have that tone just to sustain the tone. It's kind of weak muscles. So if the muscles are weak, you can understand they can't grasp, they can't create a strength around that organ. So this is the female, you can say, vagina, and these are the muscles. My fingers are muscles right and left. If my muscles are weak, so you can understand that this organ, vagina, central organ, now the downward we have a gravity central, so they can start pulling it downward and it can lead to somehow, somewhere prolapse also. Organs can start descending out. Vagina can start descending out inside this vestibule. Even from the vagina, you can see that we have anterior organ. So from the vagina, this urethra can start falling out if these muscles are not tight enough, strong enough here. I don't know, tight, should be strong. So if these muscles are not active, not strong, so they can't compress this vagina. So from the vagina, even cervix can start falling down, uterus can start falling down, uterosil can happen, bladder can start falling out, cystosil can happen, urethra can start falling out, rethrocil can happen. So these are all prolapse. Rectum can start falling out, rectocil can happen, and believe me, so many of 50% of female after menopause, they are suffering from some degree of prolapse. It can be any organ. And not only that, even you can say the vagina itself can start falling out. So we need a good muscles around that, which can create a kind of strong contraction and sustain the contraction throughout the day. And there should not be no loading or kind of pulling off the gravity. We can prevent that as well. Not only the gravity, even intra-abdominal pressure, always kind of doing this kind of pressing this downwards, increasing the pressure, and that can also push that organs downward. If your muscles are not strong, upward will push downward and gravity will pull downward from the vagina. So it can definitely lead to prolapse. So these kind of things can happen around the vagina. If even the vaginal laxity, muscles, female will not feel any good sensations during sexual activity. So not again orgasmic dysfunction. Okay, she will not feel good. So sex can be difficult, sex can be difficult, like if the muscles are tight. Sex can be like not giving her any sensation if muscle don't have strength. So sexual activity as well as supportive activities, organ support. If the muscles are good, strong, organ will be supported, up ascending pressure will be there. But if the muscles are over tight, so you can understand, more ascending pressure will be there over the organ. Something is moving you more upside. So more pelvic tension will be created inside the area if the muscles are tight. So we as a physio can relax the muscles and balance the pressure inside the pelvic cavity. And we can strengthen the muscles and we can definitely do the other work, other side of the work. Okay, so this is the support which we can do around the urethra. So this is the right time that we should start talking with the urologist, gynecologist, and we can help their patient if the muscles are tight. Okay, the second is rectum. You can say that in male and female, both the cases, this is the rectum. Rectum has one canal, anal canal, and anal canal is passing through this pelvic floor again. So if these pelvic floor muscles around the anus, if they are weak, so what will happen? The stool can start, stool leakage can happen, so leaking of the stool, or this descending pressure because muscles can't create a compression. Now we are having so many small veins over here around the anus. So many veins are there, the whole 360-degree. So those veins, what they are doing actually, arteries are bringing the blood and veins are taking the blood back towards the heart. So venous return is very important function of our body. So blood will come around, they will do the arterial supply around that whole anus, and after that vein will take it back. But assume that if the gravity is keep pulling you down and your muscles are not strong enough, so if they are not, so this is a hanging, so this is a downward vein. And I want a strong pelvic floor which can create a compression like your calf, how the calf is getting compression and the venous return is facilitated. Same way, the pelvic floor muscles, external anal sphincteric muscles are strong enough which generate internal anal pressure, and due to this anal pressure the veins are getting compressed, and due to this compression they are taking the blood back and venous return is always good. But if these muscles don't have strength to compress, so veins can't take the blood back towards the heart, and there are high chances that they can start storing the blood for some time. And due to this mild kind of the protrusion of this vein where the blood is there, old stagnated blood can be there, and that can give piles and hemorrhoids. What is piles and hemorrhoids? Protrusion of the veins. Why the veins are protruding down? Because the compressive force is not there. So muscles are not strong enough around the whole anus. 3.5 centimeter anus is around that 3.5 centimeters strong pelvic floor muscles are. If those muscles are weak, they can't create a compression. There will be no increased pressure over the veins, no venous return, and the piles and hemorrhoids. So means weak pelvic floor can give a person stool leakage, gas leakage, or piles. Other side, if you try to understand, if these muscles around the door of anus, if they will be tight, so what will happen? So these muscles will not let the door open. So whenever person will try to pass the stool, so passing the stool can be difficult for the person. So defecation, pain, defecation issues, okay, problematic defecation, and might be not feeling like not completely emptying that stool if the muscles are tight. So we really need to relax the muscles if there's a difficulty with defecation, and if the leakage is there, we have to strengthen the muscles. So these are the three important organs where we can play a big role. So we can definitely work with the colorectal surgeons as well. Whenever the piles, they are operating for the piles, after that the anus can go for stenosis and the whole structure can get somewhere tension and tightness. So post this hemorrhoidectomy, again we have a big role to play. We can help the healing process and we can help creating the good mobility around the area after having the hemorrhoid operations or surgeries. So it is very important to understand that what we are doing, we can play a big role in bladder health, we can play a big role in reproductive health, sexual health, as well as organ support and anal health, what we're saying, bowel health. So bowel, bladder, sexual, reproductive, pelvic floor therapist can understand that muscles are present and muscles can strongly tight, it can become tight or it can be over weak. And not only that, you try to understand like these muscles. I'm going to take you through that small introduction of the muscles also after that. But you try to see like these muscles, the deeper muscles are coming from the pubic symphysis, and this is this muscle, the central muscle, you can say that this muscle is going from pubic to all the way merging into the coccyx. Now these are the side muscle from ilium, they are going towards the coccyx, and now from the side also they're all merging around the coccyx or the sacrum. So these muscles from pubic to coccyx, pubococcygeus, ilium to coccyx, iliococcygeus. This pubic and ilio, they are the levator ani. They're the two division of the levator ani. So these muscles are directly inserted into the coccyx. And coccyx is tailbone, is the lower part of your spine. You can say this is sacrum and this is the tailbone. Now this tailbone, if I'm inserting here, so you can say that tailbone has some kind of concavity like that. Okay. So if these muscles are tight, over tight, this whole muscles will be tight. So what they will do, they will pull the coccyx anteriorly. So the moment the coccyx will be pulled anteriorly and it's a tension and tightness, it will pull like that. So due to this anterior pull, so who will get compressed here? Rectum will get compressed. And this bowel health will be hampered due to this tension here because muscles are tight, coccygeal muscles will be tight. And it will be more tight, so you can understand it can even start giving you a little bit of pain around the sacrum. Upward, we want this nutation of the sacrum, but it will be counter nutation, okay? Might be more outside. And downward part, S3, S4 will go anteriorly and upward part will go posteriorly. So this is going to impact the sacrum and this can lead to back pain. Okay, so over tight pelvic floor can give you back pain issues. All the muscles which is attached here can be tensed and overstrained, and patient can show you the constipation and the, you can say, back pain. If these muscles, if they are tight, they can show you that uh, constipation as well as that. Second, if these muscles are weak, assume that the whole pelvic floor cannot pull the coccyx anteriorly. So what will happen to the coccyx at that time? Because I can't pull you anteriorly, so it will start falling backward. So you can say that S3, S4 can be more outward and S1, S2 can be more in, again back health. And another symptom will be tailbone pain, because this tailbone will not be pulled anteriorly because muscle don't have strength to pull it anteriorly. So tailbone can start falling backward. And the moment patient will sit on the surface, they might feel this pocky pain. So the coccydynia can be due to weak pelvic floor, because when you don't have strength to pull it. So this is how the system is, pelvic floor is directly related to the back health. Okay, so this is the deeper muscles. So this anterior bowel health, sexual health, even bladder health, sexual health, bowel health, and the back health. So everything, the downward core is, your floor is controlling. Okay, if more pressure is there, the floor can descend down. If more upward pressure is there, the floor can increase the upward pressure. So whenever the muscles are tight, they will apply upward pressure over the pelvic organ. Pelvic organ will be under tension. Their arteries, their system, their lymphatic system, everything will be kind of somewhere not functional properly. Everything will feel tensed and tight. So tensed pelvic cavity. This is what the deep pelvic pain syndrome. We don't know what happens inside. Internally, something is not comfortable. Discomfort person will feel, and the pain during sexual activity, pain during urination, pain during defecation, or internal deeper pain, or back pain also. So this can be chronic pelvic pain syndrome inside due to the tight pelvic floor, upward ascending pressure. And this upward pressure is going to put pressure over the organs. Their functioning will be hampered. They will be tensed. They will put upward pressure over the abdomen, and abdominal functioning will be also hampered. So the whole air pressure will be always ascending, not descending and ascending. So it will be stuck up. So this can happen if the muscles are tight. If the muscles are weak, So downward pressure over the organ, downward pressure over that abdominal organ, pelvic organ, and the pelvic floor. And they will be hampered bowel, bladder, and sexual as well as the reproductive system and the back health. So this is very important, important actually for us to understand these muscles. Okay, so this was the kind of importance of muscle, but now let me take you which muscles are present and how they are. So when we talk about pelvic floor, so pelvic floor is not one muscle, they are group of muscle. So normally if I'll ask you one question that how many muscles are present into pelvic floor? Anyone who is new with me, who has never done any of my course. So can you please write down on the chat box, what do you think? How many muscles are present in pelvic floor? Till the time, I'll answer it and I'll take you through that slides. So I hope you understood that how important is this floor maintenance is. And the organs, this whole muscles are there coming from origin insertion is there, but all the organs are not only depending on the muscles. All the organ has their own ligaments. These ligaments are holding organs, the ligaments which is holding the bladder, urethra, holding that uterus, holding that. You might have heard about round ligament, uterosacral ligament, broad ligament. They are holding the uterus. We are having a uterosacral ligament. We are having ligaments which is holding your bowel. So, and there are so many facial sheaths also helping the organs in the right positions. So their organ has their own supportive system, but their canals are passing through the pelvic floor. And this is what we have just understood, that these are the canal anterior to posterior passing through this pelvic floor. Now, these are the openings externally, which you can see that some muscles are present here. So now let's understand those pelvic floor muscles one by one. So when we talk about the pelvic floor, now you can understand that this whole pelvic area, the base and the floor is covered by the muscles. Now, when it's even male and female both, the muscles are present. Why God has not given us something strong like a bone down that part? Because the excretory system has to be functional. Urination, defecation, even sexual activity, reproduction, and after reproduction in a female body, baby, childbirth. When baby has to come out, it has to come out from this small vaginal opening. So we need, during the childbirth, we need some structure which can relax completely and which can even create a contraction also. So skeletal muscles are the perfect fit for that. That's why God has given us a fantastic muscles, which is again layered into different layers. These all muscles are present into different layers. Now let's talk. There are three layers of pelvic floor. One is a superficial, completely out. Assume we have a three door. When you want to come inside the room where you are coming, so there are three doors before coming to in. So one is an external door. We are calling that as a superficial. Then one is the muscles around that canals. So this is a middle layer, and then after that inside is the deeper layer. Superficial, middle, and the deep. So into superficial, these are the three layers. So into this superficial, if you see where exactly they are present in a female body, so we have this vulva of a female, mons pubis, labia majora, this is labia minora, this is that vestibule where urethral opening is present, this is the vaginal opening present, anal opening is present. So we have this whole structure, we are calling it as a perineum. So around the perineum, so you can say that on the side, right and left side, we are having this is a bony landmark. Ischial tuberosities are present right and left. And upside we are having pubic symphysis and back we are having coccyx. So these four are the bony landmark, anterior to posterior and lateral to right lateral to left lateral. So feel the bone, and from this lower part of the bone, pubic symphysis, muscle are going to go from here to there and there to. So all area is now somewhere covered by the muscle. The central part of this area, so I assume drawing a straight line from one pubic symphysis, one ischial tuberosity to other ischial tuberosity. And again, one straight line from pubic symphysis to the coccyx. So you will feel one plus kind of thing. So the central part of this is a very important area. This is the central part. This central part, we are calling it as a perineal body. So means that is the main central part where so many muscles can come, insert, or someone can even originate from that area. So you can say perineal body is a kind of hard cluster where so many things are joined. The fascia, connective tissues. So over here, this just beneath that. Let me show you. This one. Can you see this one? You try to correlate. So this is the perineal body where every muscle from anterior to posterior are going to somewhere merge or going to come out. So that's the central part, perineal body, and these are the four bony landmark. Now, assume that you are removing the skin, and just beneath the skin, you will, okay, sorry, before going it, you can say that in a female body, there will be three opening, urethral opening, vaginal opening, and anal opening. In male body, there are two opening, urethra as well as that anus. So two hiatus are present in a male body and three hiatus are present in a female body. Okay. So there are, you can say that if you draw a straight line from pubic symphysis to ischial tuberosity, ischial tuberosity to the coccyx, coccyx to the other ischial tuberosity and up. So you can feel a diamond-like structure. So this diamond-like structure is covered by the pelvic floor. That's why the reason is we are sometimes telling the pelvic floor muscles are diamond-shaped muscle. Okay, because they are covering the whole diamond which is present there. And now this diamond we can divide into two triangles. So you can divide it by one right and left triangle by drawing a straight line from one pubic symphysis to that downward coccyx. So you can see there's a right triangle and this is the left triangle. So right or left side of the body, the whole body, every muscle of our body is right and left, isn't it? So this muscle is also right and left. So this is not a whole one pelvic floor. No, some muscle fibers are going to come from right sides and some are going to come from the left side and they're going to do merging around. Okay, so right and left side of muscle. So this is the triangle you can say, or other is anterior and posterior triangle. So how can create an anterior posterior triangle? From one ischial tuberosity, draw a straight line to other ischial tuberosity and upper, you can say this is upper triangle. So this is a upper triangle and this is a lower than the perineal body is a lower triangle. So depending upon what is present into upper triangle, urethra is present into upper triangle, vagina is present into the upper triangle, clitoris or penis, which is a reproductive system, is also present into upper triangle. So this triangle, we are, so clitoris or the vagina, or might be you can say in a male penis, they are genital system. So genital system is present up and urinary system. So urinary system is also present. So we are calling that upper triangle as a urogenital triangle. So above than this perineal body, so all the female, you can touch, you can feel that just below your vagina, one skin is there. So from that skin upside is the upper triangle. So that's the perineal body. So from down to the perineal body, anorectal triangle, because anal and the rectum is present into downward triangle here. So this is an anorectal triangle. So this triangle is an anorectal triangle and this triangle is a urogenital triangle. In male body, you can lift up the scrotum, all the things which is above than that, this panel, you can feel the skin below the scrotum. Everything above than the skin, penile body, is a urogenital triangle, and below than the skin is an anorectal triangle. So now always be careful that this is a diamond, and you can divide the diamond right and left, and you can divide the diamond up and down, or urogenital triangle or anorectal triangle, or left side muscles or right side muscles. So that's why the assessment will be always according to that. Okay. Sometimes some people can have both triangle weak. So means complete pelvic floor is weak. So urine leakage, vaginal laxity, even piles or hemorrhage, because complete pelvic floor muscle is weak, up and down. It can be right and left, both are weak. But sometimes in some people, assume that someone is having one ASI is higher than other ASIs. So whatever ASIs is lower, that ASIs can be, there can be asymmetry into pelvic floor. So right or left pelvic floor can be different. Depending upon the spine, that the shape of the spine, there can be issue. If someone is having more issue, one side of SI joint is going up, SI joint pain is all the time. So that side of pelvic floor muscle will be tight and as compared to other side, okay, which might be overstretched, overstrained. So this is always, we have to keep in our mind that it can be right or left. One is weak, one is tight. It can be down and up. One is weak, one is tight. Patient suffering from constipation, which has a tight anorectal triangle, can have a sustained downward pressure, which can lead to urine leakage. So anterior triangle is weak. due to the sustained pressure and posterior triangle is tight. So whenever this kind of asymmetry is present, we are calling them mixed type of pelvic floor dysfunction. So it is not only weak pelvic floor, it is not only tight pelvic floor. One upper or downward, anyone can be tight or weak, or right or left, anyone can be tight or weak. So this triangle understanding is very, very important. Now, into this pelvic floor, as I told you, that we have three muscles, three layers of the muscles. So muscles are coming into three layers. So this is the superficial, middle, and the deep. Now let me take you through the superficial. So this is a female body, one side, and other side is a male body. So you can see that there are four muscles are present into the superficial. Now, let me show you. This is the, what is this? Ischium, okay, other ischium, ischial tuberosity, pubic, and coccyx. Now, following this ischium, and now this one. So let me show you, let me keep some muscles here. These muscles, okay, like that. And this is the female body. So into this, above was a skin, remove the skin. The moment you will remove the skin, this will be present. So these are the superficial muscle. Now here, one right side of muscle from right side of ischial tuberosity will start coming from ischial tuberosity. It will travel and it will merge into the penile body. So this is superficial. Fibers are going transverse into the perineum. So superficial transverse perineum. Fibers, you can see fibers are very thin. It's a thin layer. Okay, so you can assume this finger is coming from here and going to the penile body. Superficial part, transversely fibers going into the penile body. So merging into inserting into perineum, originating from ischial tuberosity. So superficial transverse perineum of one side. Same way, superficial transverse perineum of other side. So this is the one muscle of your pelvic floor. And these muscles are very important. How? You can understand that these muscles are creating a straight, it's going to create a, it's coming from ischial tuberosity to the perineal body. So they are doing the stabilizing of the perineal body with the ischial tuberosity. It's a stabilizer muscle. So now let me create it and show it to you. Okay, and so look, this is a muscle. This is the wrong image actually. Okay, this is the right image. Look, from ischial tuberosity is coming and merging here. One side, so can you see the fibers are transverse? So why the fibers? I'm telling you, because whenever muscles are having trigger points, you are doing some kind of massage, mobilization, cupping to these small muscles. So you should be knowing that these fibers are which direction you have to move. So lateral to central, this kind of movement, always outward movement, inward movement into that direction, because muscle fibers are like that. So this is other side of muscle. So superficial transverse into perineum. So superficial transverse perineum. This is the first muscle of superficial layer of pelvic floor. Now what it is doing? It is creating the stabilization of both ischial tuberosities. We don't want ischial tuberosity to come in closer to each other. Now try to come to the pubic arch angle. You remember I told you that we have a pubic arch angle. Normally this pubic arch angle is 90 degree in female and approximately 70 degree in male. So now 90 degree means that if these muscles are fine, okay, they can create a stabilization, good stabilization. So that ischial tuberosity will be at the same distance, good distance. But assume that these muscles are tight. If these muscles will be tight, what they will do? They will pull the ischial tuberosity together and the pubic arch angle will become narrow. So narrow pubic arch angle means tight or shorten superficial transverse perineum or perineal, these muscles which is coming from this side. So these muscles are providing a stability to the ischial tuberosities. Now see that as respect to the back health. If these muscle, this space is good. Okay, so they will be good, and this pubic arch angle will be 90 degree. But assume they are tight. So what will happen here? The first will be that now we are having one inferior tubercle, one is a superior tubercle. So this inferior tubercle, the moment you will pull them, they will be tight. So this upper side superior tubercle will be wide. So patient can start showing little bit pain around the pubic symphysis, superior tubercle. You can say space will be increased here. And those muscles which is inserted, they will be, it can even give you diastasis recti below the umbilical level, because muscles are, this pubic arch is tight and these muscles are tensed. So they can narrow down your outlet from here. It can also narrow down the outlet around the urethra. So urination pain can be there. Even around the vagina, vaginal pain can be also there. Sexual pain can be also there. The tension, vulva will be also vulvodynia, because muscle can be tensed and tight. So there is no blood circulation around that can be also hampered. Lymphatic system can be hampered. So the shorter pubic arch and pubic symphysis pain, diastasis recti, pubic recti, and urogenital issues. So this is what happens anteriorly, but what happens at the back? So the moment these muscles are tight, can you see what happens at the back? There will be SI joint dysfunction. If the both muscles are tight, so both side of SI joint pain. If one side of muscle is tight, one side of SI joint pain. This is the answer that so many of our patients, they are coming for back pain and we are treating them 100% from our side, but still their pain is not going. And if she's a female, we should always ask one question to the female. Are you mother? After mother, what was the mode of delivery? If it was mode of delivery, normal delivery, vaginal birthing, through vaginal birthing, ask if, like, do you remember any stitches coming on your area? So you might have heard about perineal tear or episiotomies. So whenever they are cutting that area, so due to, let me show you. So they might be cut when the baby came out, they might be cut here. And due to the cut, sutures, due to the suture, scar, adhesion. Due to this muscles might be central tensed. And that can be both side of SI joint pain. But if there was a mediolateral episiotomy, one side cut of that, one side of that cut goes there. So one side of the muscles can go for shortening. So this right or left side where the mediolateral episiotomy happened, those muscles can be short and tight, and they can give pain to that side of SI joint pain. So this is why always ask these questions if she's a female and the pain around the back is always there. So start asking the question, are you a mother? What type of mode of delivery was there? And according to that, pelvic floor rehabilitation is very important. Might be she has a still tight scar or tension into those small muscles, which is leading the back health issues. If he's a male, ask the person that, are you riding the bicycle a lot or bike a lot? Because whenever the perineum is directly touching that seat, hard seat, it can create a tension around the area. Ask the patient, are you suffering from constipation? So ask some questions related to the bowel health and the gut health, as well as that what the posture the person is doing. So that can create a tension around this central area, and it can be the reason why this pelvic might be back health issues due to the tight pelvic floor. You can simply ask, do you have pain during urination, sexual activities, or defecation? If they are having pain, so there might be tight pelvic floor. Okay, and check their pubic arch angle. You don't have to remove the cloth, just check the pubic arch angle if they are more narrow or it's more wide. So whenever this is the one side of the story, the muscles can be tense and tight, these muscles specifically. Other side of the story can be that if these muscles are, if this pubic arch angle is wider than 90, assume it is 110, 120 in female. So what will happen, that ischial tuberosities are not together. There is more outward. So outlet is more open. So means ischial tuberosity, more bigger pubic arch angle, pelvic outlet is open. If the pelvic outlet is open, so there's a more stretch out superficial transverse perineais. So stretch out superficial transverse perineum. So what can it go? It can give always more open outlet and more strained down, more weaker pelvic floor. And not only the weaker pelvic floor, you can say if these muscles are loose, again it can give you, it looks very carefully here. If this is little bit slide out, so pain again at the back. Okay, so weak pelvic floor can give you pain, lower side of the sacrum. Tight pelvic floor can give you pain, upper side of the sacrum. Okay, so sacral pain is directly depending upon what is the status of the stabilizer down there. If stabilizer is tight, upper side pain. If stabilizer is weak, lower side pain. Okay, so this is very, very important. Next time when you have a patient, please ask that, oh, are you a mother, or do you have urine leakage issues? If you feel that she's having pain, ask her that, do you have pain during urination, sexual activity, or defecation, or constipation? Do you have pain? If there's no pain, then ask the other side of question. Do you have urine leakage? Or do you have some kind of, do you have hemorrhoids? Okay, this will give you a little bit of clarity what is the status of pelvic floor. Just ask the symptom. Okay, I'm not telling you to ask her to remove the cloth or him to remove the cloth and assess it, but just ask the symptoms. Symptoms will tell you, and you can correlate your back health issues with the pelvic floor. So this is the first muscle, superficial transverse perineum. After that, one muscle is going from penile body, crossing that vaginal opening as well as urethral opening, that is coming from one side and going upward, and it is inserted into sexual organ. So we have a sexual organ, clitoris. So you might have seen clitoral hood. Just below the clitoral hood, the clitoris is there, and clitoris is, again, it is not a small organ like uh, kind of P shape or ball shape. The organ is, this is a sexual organ, quite big. So it is not the thing which is visible, just small tip. No, the tip is just this thing, this part which is visible externally. The whole organ is situated inside. So this is the clitoris of a female. The male is having the body of the penis, and then a root body, as well as that glans. Same way, we also have, this is the root, this is the root here, this is the root, these are the legs, and this is the body, and this is the glans. So male has a small legs, we are having the sexual organ. Penis has a small legs, we are having large legs. Now these legs, this clitoris is situated like this in a female body, like that, okay, following your ischial tuberosities. So you can from your ischium bone, so you can palpate the female ischial bone. Just adjacent to that, this legs of the clitoris is going like that. So this is a quite long organ, like 3 to 4 centimeter long legs are there. Okay, so not a small organ which is like that. Second, on the top of this organ, over here centrally, so from down up, this is the bulb of vestibule. On top of that, one muscle is going and inserted into the clitoral body. So this is the bulb of clitoris, bulb. So the name of the muscle is the bulbo, and clitoris is cavernosa. Clitoris has a structure, cavernosas. So bulbo, cavernosis. So on the top of the bulb going to the cavernosas means sexual organ. So bulbo cavernosis is the name of this muscle. Okay, so in the image I can show you this muscle, how it is going from here on the top of the bulb means this part, okay, and into the cavernosal structure means cavernosas are structures into the sexual organ which is present in a male penis also and in a female clitoris also. So bulbocavernosus is the name of the muscle. So right side bulbocavernosus, left side of the bulbocavernosus. Origin is from the ischial tuberosity, from this penile body, and insertion is into the sexual organ clitoris. One side of clitoris, other side of the clitoris. Now these muscles are very, very important because the insertion is directly into the sexual organ. So they have a role into sexual organ. So this muscle you can see in a male and female body in this image. Look at here. So this is the upper going on from starting from penile body going up into sexual organ, going up other side into sexual organ, bulbocavernosus. So split it into two parts because we have two organs in a female body, urethra and the vagina. And when the baby will come out, this muscle has to go for completely stretching because baby head up to the level of baby head. It will go on the sides and baby head will come out. So this is a more external muscles, superficial muscles. During sexual activity, penetration into the vagina, these muscles should be relaxed. If these muscles are tight, door will be close. You can't go inside. This is the vaginismus. So when this muscle is tight, it's a kind of you can't go. You can't, no penetration allowed. And female will not tolerate that touch because this bulbocavernosus can be tensed. So closing around that and it is tight here. So urination pain can be also there. Sexual pain will be also there. So during the sexual activity, whenever female will be aroused and clitoris will be going under this physiological process, so this can lead to pain around that clitoris during sexual arousal stage. So sexual pain, so these muscles can give you sexual pain, urination pain, as well as that penetration pain or not allowed pain around that area. If those muscles are tight during the childbirth, so you can understand baby head will stuck. And then because muscles are not relaxed, muscles are shortened, then doctor has to do this cut, episiotomy. They will cut the muscle to make the room. So during the childbirth, this muscle plays a big role. Muscle should be relaxed. So it can facilitate the childbirth. Those should have that kind of relaxation capacity. So this is very important, bulbocavernosus in a female body. Next, you can say in a male body, bulbocavernosus is not split into two parts because we don't have, it's only one penis. So bulbocavernosus is coming from here and is all merged around the base of the penis. So assume that this, if this is that what you say, penis, this is the glands up here and this is the body, and this white black part is where what the muscles are. So that around this half part of the body of a male penis, muscles are wrapped like this. Okay. So these muscles are behaving like a ring, like a cap at the base, and they are going to help in sustaining and maintaining erection. The more stronger these muscles will be, more stronger compression they can create around the base of the penis, and at that time erection, the whatever blood came into the penis, it can sustain. So you might have heard about these issues that some male can have erection but they cannot sustain erection for a longer time. So have erection means blood supply can come, so, but they can't sustain erection means either the veins are dilated, over dilated, or either these muscles are weak. When they are weak, they can't create a compression. When they can't create a compression, veins can take the blood back towards the heart. Venous return will be always high. So erectile dysfunction, one reason can be weak pelvic floor, weak bulbocavernosus muscle. Understood? So this is the importance in a male life. Erectile dysfunction, 40% male after 40 years, 50% of male after 50 years. These muscles are creating these issues. So you can understand how much big role we can play as a physio, as a pelvic rehab therapist, if you have understanding of the pelvic rehab. Okay, we are physio and we have this added knowledge about this muscle. So definitely we can help in erectile dysfunction by strengthening this muscle. Okay, so this is a bulbo in a male. Third muscle is on the side. You can see that this is the ischium bone. And in a female body, I told you, what is there following the ischial bone? This legs of clitoris, isn't it? And the same way, male also, legs of the penis is there on that, following this ischium. So on the side, following the whole bone, the muscles are going up, they are originating from here, and they are inserted into the sexual organ again. So this is the upward fibers like this in a male body. Ischium coming from ischium. So ischio going into the cavernosa. Ischiocavernosa. Cavernosa means sexual organ. So ischiocavernosum. So means they have a directly role into sexual activity because they are over the, if my finger, if this is a clitoris and this finger is the muscle, so my role is directly into the sexual behavior. So just below my finger, below this bulbocavernosus muscle and below this, the arteries are going upward towards that sexual organ. So the more stronger ischiocavernosus, more stronger compressions over the venous system and that arteries, it is going to work as a pumping action. It's going to create a pumping action. The way the calf is doing pumping, move the blood upward, the same way this muscles ischio will do pumping during sexual activity like a pump. It will compress, and due to this frequent compression, it has more number of fast twitch muscle action. So due to faster compression, more blood will go towards that cavernosa towards the sexual organ, and feeling of blood will be there. So erection will happen. Erection will be into the male penis, or erection in a female, you can say legs. So erection. So whenever we say that who is responsible for erection, blood is responsible. So who, even if we talk about the blood circulation, so we need to have a more blood going on into the balloon. Assume the balloon, these organs, sexual organs are balloon, penis or clitoris. So whenever more blood will come, then they will get filled up. When they will get filled up, they will, this nerves will get stretched. They will send a signal to the brain, stretching. So there's a nerve that blood will, brain will get a good sensual sensation, because all the nerves are getting stretched out. So this is a arousal response, okay, or the urge of having that kind of good sensation. So we know that we need, for this kind of urge or this orgasm, we need first erection. For erection, we need blood to go there. And these muscles, ischio is working as a pump. They are going to facilitate more blood, more pumping, more blood push towards the cavernosa. So more better erection can happen. So all the male who are not having erection, so which muscle is responsible? This muscle. This muscle is weak. So when this muscle is weak, they might not create a pumping. So they cannot push the blood upward towards that penis or clitoris, and that's why there is no erection happening. So if erectile dysfunction is there, no erection, so ischiocavernosis is there. But if erection is there, but it can't sustain, then bulbocavernosis muscle is weak. So this is very important. Ischiocavernosis muscle, only role of this muscle is pumping the blood towards the sexual organ. Sexual role, arousal. It is going to facilitate the arousal and erection. Okay. Erection will not happen, arousal will not come. Okay. So this is very important. Ischiocavernosis. What was the role of superficial transverse perineum? Stabilizer. What is the role of bulbocavernosis? Opening and closing around that urethra and vagina whenever is required, during insertion, during taking the baby's coming out. So relaxation, during insertion, relaxation. And good contraction means better facilitation towards that sexual organ also. So, and in male case, maintaining the erection. So this is how, these are the three important muscles of urogenital triangle. So one is superficial transverse perineum on the side. This is, one is upside, and then this. So you can see this is a left side of small triangle made by this superficial muscle, right side of small triangle, and this is the complete upward triangle. Okay, upward triangle, urogenital triangle, right and left side of muscles. So altogether, 6 muscles are present into upward triangle superficially. Right side of superficial transverse, left side of superficial transverse, right side of ischiocavernosis, left side of ischiocavernosis, right side of bulbo, left side of bulbo. So 6 muscles, 3 right and 3 left, present into the urogenital triangle superficial layer. Now, you can say that, now let's go towards that downward part, anus. The muscle is going from perineal body and looping around the anus, and in kind of loop around like this. It travels from 12 to 3, 3 to 6, assume a clock, okay? So 12 o'clock is upside, assume a wall clock. So 12, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So how this muscle is going? Coming from perineal body, going towards that 3 o'clock, 3 to 6 o'clock, 6 to 9, 9 to again, it is keep going on like this, and going to create looping around the whole anus. So if this is the anus, so assume that one loop start from here, start, and now again 3, like that. It's going to be 1 loop, 2 loop, 3 loop, 3 loop around that. So upper, down, so this kind of looping. So let me show you in the image. So external anal sphincteric muscle. It was very nice image I was having. Yeah, this one. Sorry. Look, this is the muscle. Okay. So came from perineal body and loop around like this, another round, and then inserted inside the anococcygeal ligament. So this muscle, external anus sphincter muscle, has a 3-part, because 3 loops are there creating around the whole anus. So outside, below the skin is a subcutaneous part. then a superficial layer inside and the deeper layer inside, like that. So this anal sphincteric muscle is coming from 12 o'clock, 1, 2, 3, 4, 5, 6, 7, 8, 9, one loop. Then the second, so assume you have a floor, one floor, second floor, third floor, and insert inside the posterior towards that coccyx, anococcygeal body. Like anteriorly, we are having penile body. Same way, posteriorly below that, just above than the coccyx, we are having anococcygeal body, anococcygeal ligament. So this muscle is looping around and inserting there. So this is very important muscle, which is creating a complete sphincteric action, closing action around the anus. So more good closing, 360-degree closing. So this 360-degree closing is going to help maintaining the stool continence, because stool is hard. It is kind of, it has a weight, and once in a or twice in a day only we have to keep storing the stool. So we don't want the stool to come out. So we really want very strong system around that. So that's why external anal sphincteric muscle is one of the strongest muscle of pelvic floor, which maintain the stool incontinence. And again, you can see over here, this blue part, these are the veins present upside into the anal area, upper part and the lower part. All these veins are there. So the more stronger muscles will be, pelvic floor muscles will be, more better anal pressure will be, more better compression will be, more better venous return will be. They can help into circulation also. So what is the role of these muscles? They are doing three main function is a sphincteric action, closing of the door, opening of the door, closing and opening, sphincteric function around the anus. So you can, if these muscles are weak, stool leakage, gas leakage, piles. If these muscles are tight, no defecation issues. Okay. And layers can be tight, superficial, subcutaneously, superficial, and deeper everywhere. So you have to keep inserting the finger and keep relaxing that. This is kind of you are going to learn into workshops whenever you come, transvaginal, transrectal approach. So this is a transrectal approach of the finger and doing the assessment. And you can understand how important this muscle is. The first function is a sphincteric function. Second function is a circulatory function. The good compression, good strength, good compression, better venous return. No piles, no hemorrhoids. Third is, it is not written in any book, but I always believe that it also has a role with the back health, because this muscle is coming from perineal body and going and inserting into that anococcygeal body. So it is stabilizing the perineal body posteriorly. So if this muscle will be tight, the perineal body will be pulled posteriorly and urogenital angle will become more bigger. So this is stabilizer also of that posterior triangle, because it's a central muscle. So it stabilizes the distance between the perineal body and the coccyx. So it's a stabilizer of the posterior compartment around the anus. So three important functions, 80% I can say is a circulatory and the sphincteric, and 20% is a stabilizing muscle. So this is an outside muscle, external sphincteric muscle. Central is this one. This is that what we say is the perineal body. Now, I think you understood. This is a superficial transverse perineum. This is external sphincter. This is upside ischio. This is the bulbo. So what the role of bulbo? Sphincteric, supportive, stabilizer from pubic symphysis, this clitoris to the perineal body. So it's also stabilized, maintaining it upward. This is also stabilizer, maintaining the distance from perineal body to the anococcygeal body. Sphincteric action. So these are two are sphincteric, upper sphincteric, lower sphincteric. You can feel that. And this is a stabilizer on the side. This is sexual. So ischiocavernosus, IC, bulbocavernosus, BC, superficial transverse perineum, STP, and external anal sphincter, EAS. So these are the superficial layer of the pelvic floor. And this is the same in male and female, except that bulbocavernosus. Okay, you can see in male body also, this is the same. Lower part, and this is the anococcygeal body, this is the coccyx. If this muscle will be tight, so if the coccyx pain can be there, around the sacrum pain can be there. If these muscles are tight, external sphincter, constipation, defecation issues, back health issues, back pain, more lordosis, lumbar lordosis will be also present, anterior pelvic tilting. Okay. You can see in male, this is a kind of looping around the bulbo, and the other muscles are same. So these are the four muscles in superficial transverse perineum. And these muscles are supplied by pudendal nerve. So pudendal nerve is coming from S2, S3, S4. and they are just inserting into this compartment just below the ischial tuberosity and divided into three layers. One is going towards the clitoris. This is the upper part, and this is the middle towards the vagina and penile body, and this is the lower around that anal body. So these are the three bifurcation of this pudendal nerve. Okay, so inferior rectal nerve, middle penile nerve, superior dorsal nerve. Take a screenshot. Okay. Pudendal neuralgia. Sometimes, oversensitivity, some kind of compression of this nerve. So patient can have a pudendal neuralgia. And one fact around that sexual organ of a male and female is, you can see this is a clitoris of a female and then male penis also. New studies are showing that clitoris of a female is the one organ in a human body where maximum number of nerves are ending, even more than the penis, glands of the penis. Glands of the clitoris has 12,000 nerve ending. So you can understand how sensitive is the glands of the clitoris of a female, or glands of that clitoris. Male glands has 8,000 nerve ending. Female, small clitoris as per your in most of the people's eyes, 12,000 nerves ending. This is the news studies. And even fact about the clitoris was, most of us, we don't know the clitoris is that big. It has that many of nerve endings. Highest into the whole body. You can understand all the other nerve which is somewhere ending is ending into the clitoris. That's why this is a sensual organ, the most sensual organ of a female body, which can lead to orgasm. If this organ is not stimulating, female will never have orgasm. So vagina is not sensually sensitive. Clitoris is sensually sensitive. Vagina don't have any nerve ending. Okay, it don't have any nerve ending. If you just assume that if vagina is sexually sensitive, so whenever doctors are doing ultrasound examination, at that time female should have that kind of sensation, sexual sensation. But she never had this sensation whenever we are doing palpation inside the vagina. So because there is no sensation inside the vagina, okay, it's only 15 to 20% sensitivity, not more than that. So vagina is not a sexual organ. Female has a different sexual organ, that's the clitoris. After this, assume that, see now this structure. That was external superficial muscle. I have removed the superficial muscle, ischio from here, bulbo from here. After that, you can see this clitoral, this bulb is present. Below, we have a greater vestibular gland. Bartholin gland is also, we are saying, you might have heard about Bartholin cyst. So these are the glands. It has an opening. Sometimes this opening can get blocked and they can start getting cyst formation inside and swelling inside one side of the area. You will learn more about that in workshops or any online course you will do with me in detail. After that, you can say that if you just remove it, this organ, sexual organ, clitoris of a female, even male penis also, so this is a female clitoris, you can see downward because there was urethral opening, isn't it? Which is outside and bulbo was going and vaginal opening was there and bulbo was going. Now, after removing the bulbocavernosus muscle, bulb of clitoris, now you can see this middle layer, and middle layer is now wrapped up. Every muscle of the body is wrapped up in the facial sheath. So this is the one fascia which is kind of covering it. So this, after remove the fascia, you can see directly the muscles. So muscle is, there are three muscles present here into this upper triangle. So this is the upper triangle, urogenital triangle, because this middle layer is not present into the lower urogenital triangle, because urogenital triangle is completely covered by external anal sphincteric muscle. That is only looping around from out to in. What I have just seen, we have just seen three compartments it has created. So this middle layer is not present. We are calling it the deep penile pouch. So this deep penile pouch or middle layer, they are not present into anorectal triangle. They are only present into new muscles, are only present into the middle layer of a female urogenital triangle or a male also. Into this triangle, above was a superficial transverse perineum. Just below the superficial transverse perineum, same muscle is present. The same structure coming from ischial tuberosity and going into penile body, and we are calling it as a deep transverse perineum. So this you can say stabilizing. So the stabilization responsibility is not only the responsibility taken care by superficial, there is a supportive staff downward. So upwards the superficial, down we have a deep. They both are going to do best stability around the ischial tuberosity. Back health will be good. So this is how deeper transverse perineal muscle, just below the superficial transverse perineal muscle. Same role, same function, same stability, and responsible for that angle, pubic arch angle, responsible for the back health. Okay, and maintaining that opening and closing of that uh, pelvic opener, or it's more outlet is open or outlet is narrow. If these muscles will be narrow, so outlet will be narrow. So deep transverse perineum, and now same way, starting from that penile body, muscle was going upside bulbo, but over here muscle is again going on upside, crossing that vagina, and they are going up, and their fibers are merging around the urethra. Bulbo fiber was merging around that clitoris, but these fibers are merging by crossing the vagina into the urethra. And this is urethro, you can see uretrovaginalis muscle, uretrovaginalis sphincters. So crossing around the vagina and then merging, crossing around the urethra and merging into the urethra. So if I'm urethra, so muscle will merge with me in my skin, smooth muscles. They are going to merge with the smooth muscle. So uretrovaginalis muscle. So what is the role of this muscle? Providing opening and closing around the urethra out in 360 degree. So you can say it is not 12 o'clock, but it is around 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So this muscle, so vagina. So whenever you insert your finger inside the vagina, you will feel that 11, 12, so contraction will be there. But more stronger contraction will come from the 6 o'clock. 12 will feel less contraction because we don't have any muscle coming directly from the up. All the muscles are going from down to up. So uretrovaginalis muscle. Second muscle is above we were having ischiocavernosus, just below the ischiocavernosus, coming from the ischium bone, origination from the ischium bone, and they are going towards that urethra, and those fibers are merging together. So urethrovaginal sphincter from down, and this from the side. This is a urethral compressor. The name of this muscle is coming below the ischial tuberosity, urethral compressor. So now you can say that from down muscle is coming, from side the muscle is coming. Both, now I'm coming from here, you are coming from here. We will merge here and we'll loop around the urethra. So this is going to create a compression, strong compression around the urethra. Now let me show you in this image. So this is vagina. From down, this muscle is coming. Uretrovaginalis compressors or sphincters, they are coming. From side, ischium, these muscles are coming. They will merge together, create a loop all around the urethra. 4 centimeter long urethra. This whole is going to loop around by this muscle. So you can see in this image, muscles are coming from down and from the side and all looped around the whole urethra of a female. And now tell me, whenever person is having urine leakage, so which muscle is weak? This muscle is weak, middle layer, okay, because that this is its responsibility to creating the compression of that. If this muscle is over tight, urination issues, voiding issues. If this muscle is over weak, so it will fail to create a compression and then the leakage of urine, because upside into the bladder we are having urine and it is liquid. So if it is, there is no compression, 360 degree, urine can start coming out and drop out. So whenever during the stressful situation, whenever you are jumping, sneezing, coughing, suddenly pressure will increase, and if these muscles are weak, little bit of drops will come out. So this is a stress incontinence. So in stress incontinence, who is weak? Pelvic floor muscle is weak. Which layer? Middle layer. Okay. That's why transvaginal approach, transvaginal stimulators, periometer, something you have to insert into the opening, into the canal, around the canal, and then you stimulate it, you activate it, you stimulate it, you strengthen it by some proprioception into the canal. You cannot only give Kegel to the person and assume that you are doing it. Assumption work will not work here. You have to facilitate the work. That's why Kegel exercises, hold, try to assume holding, feel that you are doing it. it fails. 98.7% Kegel is not working in urine incontinence cases. Now you can understand why. Because you are asking the person to feel it. You have to sometimes stimulate it also when the muscles are over weak. So this is the middle layer, which has a 3 muscles. In male body, we don't have this, this ureterovaginal sphincter. Instead of, and we don't have this sidewise compressors. Instead of that, we are using the term rhabdosphincter. Rhabdosphincter is the muscle. So assume the same muscle, this muscle which is coming from the side, this one, which is coming from all the sides. The name of this muscle which is going around the penis, this muscle or penis or base of the penis, and the above than the base of the penis, prostate is there. So these muscles are inserted into the prostate. Half of the muscles are inserted inside the prostate. Half of the muscles are inserted into the base of the penis. So they are rhabdosphincteric, like a side muscle. Okay. You can say this is upper part and then the posterior part of the prostate. So they are going to help into during ejaculation. When male is ejaculating, forceful ejaculation, if these muscles are strong, they will create a strong ejaculatory force and better ejaculation of the semen will be there. Even during the urination also, these muscles are contracting to empty the urethra. Because you can say this is the urethra. So these muscles has to compress the urethra, and so emptying of that can happen. If these muscles are tight, so they can give prostate pain also, and they can also give urination pain. Urination can be difficult. So this is the middle layer of a male. Okay, coming from the sides and some fibers around the urethra, some fibers around the prostate. Male muscle. And sidewise we have same, downward we are having same deep transverse perineum. The 2 muscles are present in the male body, deep transverse perineum and rhabdosphincter. 3 muscles are present in the female body, deep transverse perineum, urethral compressions and ureterovaginal sphincters. You can see this is how they are going from the side, okay, in a male body. Take a screenshot and try to understand this image. After that, more inside, deeper layer. So into deeper layer, muscles are coming from anterior to posterior. So from pubic bone to back coccyx, pubococcygeus, right and left. Now we are having obturator internus muscle here. So from obturator, like around this ilium. So from there, fascia of obturator internus, muscle will start originating. Fibers will travel backward and they will insert into the coccyx. The name of this is iliococcygeus because they're following the ilium. So iliococcygeus, ilium to coccyx. So this is a lateral muscle of pelvic floor. This is anterior to posterior muscle of the pelvic floor. Pubococcyx, pubococcygeus, iliococcyx, iliococcygeus. So these are both of them are going into the coccyx. And now last is from the ischial spine, the muscle is going into that sacrum and that some part of the coccyx. So ischio-coccygeus. So pubococcygeus, iliococcygeus, ischio-coccygeus. 3 muscle on right side, 3 muscle on left side. Okay, like this. So this is from here, this first part going back is one side of pubococcygeus, other side of pubococcygeus, one side of iliococcygeus, other side of iliococcygeus, one side of ischio-coccygeus, other side of ischio-coccygeus. So this is the complete floor inside, deeper. And posteriorly, we are having this piriformis, which is the accessory muscle. Anteriorly, we are having obturator. You will feel that contractions, palpitations during that, further studies when you'll go, how to feel, how to contract, how to, do it. So now you can understand that these are the 3 muscles. One is this, one is this, one is this, okay? Right and left. And out of these 3 muscles, when we are talking about this central muscle, pubococcygeus, this one, pubococcygeus is further divided into 5 parts, 5 different parts. So the moment it starts traveling back like this, urethra will come first because urethra is the first organ which is going to come here, which is going to pass. So this muscle is going to support the urethra. From one side of muscle will come and merge around the urethra to support. deeper side. Other side will also come and support the urethra, and they will become pubourethralis muscle fibers. The fibers which is supporting the urethra, they are pubourethralis, but part of pubococcygeus, first part of pubococcygeus. Then after supporting it, the one set of muscle fibers will merge with the other set of muscle fibers, create a loop, pull. So whenever sneezing, coughing, so they are pulling it urethra anteriorly. So urine will not go down directly, and effect will not come into the middle layer. So they are going to create a kinking kind of pull. So like they will pull the urethra anteriorly. These are muscle fibers. They will pull it anteriorly. So due to this anterior pull, you can say that this was the bladder with the urethra. But these muscles will pull them anteriorly. Urethra will be pulled. The moment urethra will be pulled, so you can say narrowing of the angle. So in this way, urine can't come out. So this is the first action, fast twitch action, which is muscles are doing during sneezing, coughing, loading, whatever you are doing. Okay, internal pressure. So they will pull it. So this is very important pulling action, which this pubococcygeal muscle, part of levator ani, are doing around the urethra to support the continence, maintaining the urine into the bladder, not going towards that, stopping it to going towards that urethra. It will stop. It is the first door by creating this kind of kink, very important muscle. If this muscle is weak, urine will go into the middle layer and middle layer has to compress. If middle layer is also weak, urine will come out because muscle, they are also weak. So pubourethralis. After supporting pubourethralis, they will go back and loop around vagina. Okay, so fibers will keep going on down, right side, left also. They will merge with each other and they will pull the vagina anteriorly because compress the vagina. We don't want that during any situation when you are jumping, loading, lifting, that urethra should descend down. So this muscle are going to pull the urethra anteriorly, again creating the kinking, further kinking of urethra by pulling it anteriorly. So my urethra will pull anteriorly and vagina will also pull anteriorly. So these are the two, this action is happening due to this. This is a pubourethralis pull, pubovaginalis pull. So this is a third pull. Okay, same way behind. So pubourethralis, pubovaginalis. Behind that, perineum. So during that activity, pulling off perineum also, because we don't want perineum to stay there. So perineum will be also pulled anteriorly. Puboperinealis, pubourethralis, pubovaginalis, puboperinealis. Next, anus. They will pull the anus anteriorly. So puboanalis. And then we have a rectum. They will pull the rectum anteriorly. So we don't want any organ or anything descend down. So urine should not descend down. So kinking of urethra. Vagina should not descend down. Pulling of urethra. Vagina. Pulling of perineal body. Pulling of anus. Closing of anus. So nothing can fall down. Everything has to close. So system means some doors are there and you are just closing the door. Sudden closing of the door during intra-abdominal pressure. This is what this muscle is doing. So how many muscle fibers? Pubourethralis, pubovaginalis, perinealis, puboanalis, puborectans. These are the 5 parts of pubococcygeal muscle fiber. And then last, pubococcygeal is going to insert into the coccyx and they will pull the coccyx anteriorly. So back health. So this is a very beautiful structure God has created, given us. And if I'll ask you the question, how many muscles are present in pelvic floor? So this is your assignment, this is your homework, do it and send it to me, okay? How many altogether? So name it, right, left, right, left, right, left, okay? It's going to give you more clarity. So they are, okay. These are the deeper layer of pelvic floor. Now, why we are calling these two muscle levator ani? Pubococcygeus and iliococcygeus. Because the pubo is doing pulling, upward pulling, and ilio is doing inward pulling. Okay, so inward pull, upward pull. So means pull means elevation. They are going to elevate the structure upward. So this upward elevation is levator. They are going to elevate the structure. So that's why the name is levator. But ischiococcygis is not doing elevation. It is not doing any kind of inward pull or upward pull because that's the lateral muscle on the sides. So this is all that muscles: pubourethralis, pubovaginalis, puboperinealis, puboanalis, puborectalis, and then last pubococcygeus. Okay. During defecation, because muscle is already, this muscle pubo-rectalis is always pulling the rectum anteriorly. Right now, you, me, we are not defecating, isn't it? So our rectum and anus angle is 90 degrees, because stool should collect into the rectum. It should not come into the anus. So this muscle is pulling the rectum anteriorly like this, and they are creating anorectal angle. And this is very important. If the muscle is strong, then only it can pull it, and it can keep pulling it for 24 hours till the time you don't want to defecate. Once you will go for defecation, the brain will give sensation that I want to defecate, then only this muscle will relax. So this 90 degree which was pulled, the muscle will relax like this, and then the stool will start descending into the anus. Otherwise, stool will not come into the anus. If this muscle is weak, for example, stool will start descending into the anus. Into anus, it is a highly sensitive zone. The stool will do the sensation, and we might have urge that we have to pass stool. So urgency of passing stool, or again and again going to the stool, can be there, or might be leakage of stool can be also there if this muscle is failed to pull and maintain this angle. So stool leakage means this muscle is weak. Two muscles are weak: outer door, external sphincter, and this also, because it has to keep maintaining endurance. So it has a more slow twitch muscle fibers, and so it keep pulling it anteriorly, endurance, maintaining that, and creating this angle throughout that, like 24 hours till the time you're not going in. So if this is weak, then stool can descend down. It can come around the rectum, and might be, if external anus rectum, it can come around that anus lower part, and lower part of the rectum and upper part of the anus. It can stimulate it, and it can send a signal to the brain. We might go, and sometimes we might leak the stool if your external anal sphincteric muscles are also weak. Okay, and if the stool is tight, and if this muscle is weak, so stool can come tight. The consistency of stool, it is very hard stool. It can compress the veins down. It can again give piles to the male or female, both. Okay, so this is very important muscle. More detailed understanding we can do whenever you want to learn more about this pelvic floor. These are the side, ilio. You can say ilio is a supportive muscle. Support. It's always putting an upward, inward support to the organs. If this muscle is weak, organs will start descending down. Iliococcygeus. Pubo and ilio, both elevator. So they both are weak, organ descending down. Or urine leakage or stool leakage. If those muscles are tight, so that defecation, urination, and pelvic organ pain, deep pelvic pain, those kind of things can come. If this puborectalis muscle will be tight, so you can understand over tight. So instead of 90, it get 70 degree. This is what puborectalis, pugus is the word, or pubic dyssynergia we are saying. Okay, so they fail to relax. Muscles fail to relax. So it is very difficult for the person to pass stool. Okay, because muscles are over tight. So we have to relax those muscles in those cases. So this is all about pelvic floor from my side. I hope you guys learn a little bit about pelvic floor muscles. And if I just give you idea that what is the function of pelvic floor muscles, they support the organs, because organs are resting. You are an organ, you are resting on this floor. So this floor is supporting you, isn't it? If the floor is over tight, over pressure, upward pressure, and it is loose, you will descend down, you will fall down. So organ support. Stability, it is providing stability from side to side, anterior to posterior, everywhere. So pubic symphysis with the coccyx, this pubic oxygen is doing the stability. Pubic to perineum, puboperinealis is doing stability. Clitoris to what we say is the perineal body, that bulbo is also doing stability. From perineal body to posterior, external anal sphincter is also doing stability. Deeper transverse, superficial transverse is also doing stability. Sidewise, this ischio-coccygeal, ischio to spine, that is also providing stability. So many muscles are providing stability role, stabilizing the bone, whole pelvic bone, and all the angles. Sphincteric action means closing, opening up whenever required during urination, defecation, sexual activity, childbirth. Whenever we need that opening and closing, the muscles are helping us. Circulation, muscles are working like a sphincteric actions, reflexive actions, so they can help in creating a pumping towards that veins and facilitate the venous return, and creating the upward pressure over the to doing this, air pressure, all abdominal pressure, because this kind of upward, this good tone is going to facilitate that air upside. The air should not descend down and affect the muscle. So muscle has a tone, that's why air pressure will be also maintained. So this is also circulation of air, circulation of blood, circulation of the venous return, and sexual activities. I already explained you. So what is a good muscle? A good muscle is which can has a good tone. Good tone. Okay, 70% slow twitch muscle fiber should be good working. 30% action should be also good. They should be contracting correctly. If you want to hold your urine for some time, so muscle should be contracting because they have to support you. If you want to hold your gas whenever you are into meeting, so muscle should contract. Okay, and during that, if you want to pass the gas, they should completely let the gas go. If you want to pass urine, they should relax. Muscle should open, and you should be able to pass urine. You should be able to pass that stool. You should be able to have good sexual activity, good penetration inside without any pain. Okay, they should be active at the right time, like whenever you
जा नहीं यार आने की बोलेगी मुझे ये लोग नहीं तो फोटा बताओ
whenever internal pressure will be increased, those muscles should be act like a trampoline. And whenever you are defecating, urination muscles should be relaxed.
मुगल ठीक है आ कर दो तुम क्या आगे
Mute yourself.
सारा आगे
Himani, mute yourself. So this is a good pelvic floor. If the muscles are, so they should have a tone. If the muscles are more tone, extra tone, they will become hyperactive pelvic floor. Too much tension, too much active, hyperactive, hypertonus pelvic floor, tight muscles, painful muscles, irritable, irritation, defecation issues, urination issues, sexual issues, pain, difficulty into any functioning. If muscle will lose the tone, they will become hypotonus pelvic floor. Okay. So according to that, too tight, hypertonic, too loose, hypotonus. So what should be the good muscles? Maintaining the right tone. Now, sometimes it can be mixed. Sometimes there can be issues related to the hypertonus, issue related to the hypotonus, issue related to the mixed. Issue mixed. One side is weak, one is tight, or issues can be related to the nerves damage. Okay. In case of, you can understand that spinal cord injuries, nerve can get damaged, there is no sensation. So functional dysfunction can be there, centric, stability, sexual, different type of dysfunctions can be there, circulatory, neural, visceral, non-coordination. So take a screenshot. This is all you are going to, all the conditions where you are going to help your patients. Take a screenshot of this and this. And this also, this is a kind of 8 dysfunctions and everything. So dyspareunia, vaginismus is a sexual, erectile dysfunction is a sexual, back pain, SI dysfunction, prolapse, stability, renal fecal incontinence, retention, sphincteric, hypertonus is functional. So organ prolapse is a visceral, dental neuralgia, neuropathy, neural, dyssynergia is a incoordinated. So this way, this is a scale designed by me, and this is my copyright patented, and it is now published also. So, but you guys can use it whenever you want, but still more deeper understanding, you can always have more understanding with that online learning or offline learning whenever it's possible in your area. And if you are interested, please go for more upgraded knowledge. That was an introductory session. Just make you understand what the muscles actually are and how they are supporting our system. And this is another structure, another scale which I have designed is a scale for contraction. Because first is relaxation, we have to check the relaxation, then we have to check the contraction. And you can also click this slide. If the muscles are tight, what are the things which we can help with our patient? Treatment may include external, internal, soft tissue mobilization, myofascial, visual manipulation, trigger point, heat and cool therapy, TENS, electrical stimulation, all around the pelvic floor. And if the muscles are weak, so assess, like, you can say that strengthening exercise, activation with, you can say IFT, ultrasound, bladder training, neck technique, modalities which can improve blood circulation, massager, vibrator, stimulator, vaginal cones, weight, strengthening exercises, lifestyle modifications, NEMS, they all can activate, then facilitate the action, and then help into increasing the power, endurance, and stability, everything. Now the question is, we should, Kegel is the solution for everything. Is it? The answer is no. Kegel is not the solution for weak pelvic floor or even the tight pelvic floor. Kegel is for maintenance. Whoever is have a good tone, the tone should not be overactive, should not be loose. So keep doing that Kegel exercise. So squeeze the pelvic floor. So that's a part of your exercise protocol. If the issue happens, that issue cannot be taken care by Kegel. So again, stop Kegel, or where to do Kegel and where not to do Kegel. For that, you can go to my YouTube channel, Dr. Sunita Patel, and there are free videos where you can understand, like in 1 or 2 hours of videos about Kegel and reverse Kegel and stop Kegel also. So there will be 2, 3 videos you will find. So please go through that. You will give more, because you should not give Kegel to the patient. Stop giving the Kegel without assessing the pelvic floor. First, assess the pelvic floor, and accordingly you uh, plan that what will help. And these are little bit stretches. Whenever the areas are tight, you can always use those stretches. And yeah, this is a Kegel exercise. Take a screenshot how to do Kegel, but go for a videos. Videos will give you more clarities. Okay. And breathing, I already told you the coordination between the breathing and the pelvic floor. And yeah, these are the more learning whenever you are going to go for workshops by me, or I don't know, if it's someone else. So these are the simple things which we should be knowing. We are going to teach you bladder, urethra, prostate, uterus, vagina, everything into detail, physiology, functioning, micturition process, common pelvic floor dysfunctions, their assessment, their treatment, their history taking, patient guidelines, procedures, assessment, whole body assessment, perineal assessment, observations, transvaginal assessment, transrectal assessment, treatment, assessment with the using different scales, using different examination, neurological examination, doing that manual therapy, electrotherapy modalities, exercise use, lifestyle modifications, and helping your patient with the best. Thank you so much for joining me. So now let me stop record. I hope that it gave you a little bit clarity about pelvic.